Welcome to the video on the 7 symptoms of a stroke today. A month in advance of the event, you've undoubtedly heard about strokes, right? Have you ever wondered if there are any warning indications your body may send you a month or several months in advance of a stroke? You should seek medical assistance right away if you encounter any of the symptoms I'll be discussing in this video, as they may indicate an impending stroke. These 7 indicators could appear as soon as 1 month before a stroke. There is a higher chance of substantial brain loss if a diagnosis is delayed, regardless of an individual's age, gender, or health status. Stroke risk remains constant, even in young or healthy individuals. Cardiovascular illnesses are the main cause of death in the United States, where over 795,000 people have a stroke annually. These diseases are on the rise everywhere, especially among younger people. Stay with me as we explore the 7 stroke symptoms a month in advance. You'll learn how to prevent this illness and not be a part of this startling figure, which highlights numerous symptoms that manifest a month in advance. Stroke claims the lives of nearly 159,000 Americans annually. A stroke can be misinterpreted since they are subtle and often missed. It is important to recognize these indications regardless of your age, health status, or comorbidities. Sharing this video with your family and friends could help save lives, as strokes can impact anyone, so stay vigilant. Furthermore, I will elucidate the differences between ischemic and hemorrhagic strokes to augment your comprehension of these ailments. I will also discuss what a brain aneurysm is and how to recognize the warning symptoms of one. Most notably, you will discover how transient ischemic events, TIAs, can precede a stroke. Understanding their warning signs and symptoms could save your life or the life of a loved one. Keep in mind that even in the absence of symptoms, screening with a reputable neurologist is vital for the early detection of possible brain conditions if a first-degree relative has had a brain aneurysm. Let's now explore the 7 warning indications or symptoms that may appear up to 1 month prior to a stroke. If this occurs to you, get help from a doctor right away. First symptom: consistently high blood pressure. When chronic hypertension is discussed in relation to stroke risk, it becomes clear how dangerous it may be and how much it can raise the chance of a stroke if left unchecked. Blood pressure is a measurement of the force that blood exerts on the walls of our arteries. When this pressure rises, it is referred to as hypertension, and it can have serious health consequences. If a blood vessel in the brain bursts because of excessive blood pressure, bleeding may occur, which could result in a hemorrhagic stroke. This increased pressure can harm the blood vessels, causing them to weaken, narrow, or even burst over time. Similar to how high blood pressure can harm the arteries supplying blood to the brain, it can also reduce blood flow or cause an obstruction that leads to an ischemic stroke. For this reason, controlling hypertension is crucial, and adopting a healthier lifestyle and following recommended medication regimens are crucial. First steps: in order to lower the risk of stroke and other cardiovascular disorders, following actions are essential. 2. Excessive fatigue. It's crucial to keep in mind that fatigue might have other reasons. Excessive fatigue, also known as extreme exhaustion, can be a symptom or warning sign prior to a stroke. It may be a warning sign if you're feeling really exhausted all the time, which is unusual for you, and it's not brought on by physical activity or sleep deprivation. This extreme fatigue could be caused by changes in blood flow to the brain. It could also be the result of an arterial narrowing from atherosclerosis or a potential clot that is obstructing oxygen flow. Therefore, if you experience unusually high levels of fatigue, get medical attention. A transient ischemic attack, TIA, which is a momentary disturbance in the blood supply to the brain, can occasionally be preceded by acute exhaustion. A TIA serves as a warning sign and a temporary state that may suggest an imminent stroke. With a transient ischemic attack, TIA, symptoms usually subside after a few minutes to several hours and do not result in long-term brain damage. Patients report symptoms resembling those of a stroke. Sometimes, these symptoms completely go away in less than 24 hours. Usually, this happens when an artery in the brain becomes briefly blocked. At that time, the body effectively dissolves the brain clot thrombus, which causes the symptoms to subside. This quick resolution is an important indicator that a stroke might be imminent. Keep a tight eye on these people. If you observe any temporary symptoms, you should seek medical assistance right once. 3 issues with vision. If you notice any abrupt changes in your vision, hazy vision may be a warning indication. Dual perception, though there are a number of reasons for vision issues. Eye problems or trouble focusing might indicate brain circulation damage and act as warning indicators of a stroke. It's critical to pay attention to these symptoms. An ischemic stroke is frequently indicated by the obstruction of an artery supplying blood to the eye, which can cause vision loss. The most common type of stroke, so it's critical to treat such changes seriously and get medical attention as soon as possible. For intense headaches that happen suddenly, a stroke may be preceded by an abrupt, excruciating headache. It's crucial to remember that not all headaches are associated with strokes, nor do all strokes cause headaches. In the case of an ischemic stroke, the headache is caused by a blockage of blood flow to the brain, and these symptoms are characterized as intense and abrupt when they happen. When a stroke that is hemorrhagic and marked by hemorrhage, strong headaches are caused by elevated intracranial pressure in the brain as a result of bleeding, which raises brain pressure. Witnesses to stroke events frequently describe seeing the victim hold their head in an intensely painful manner before they pass out. This response is especially typical in hemorrhagic stroke cases, where the headache is often reported as the worst of the patient's life. Severe headaches can also be a warning sign for an impending brain aneurysm rupture. 5. Tingling or weakening in the limbs. A stroke may proceed with symptoms such as numbness or weakness in the extremities, particularly on one side of the body. This sudden numbness or weakness usually affects a single body part, such as an arm, leg, or one side of the face, leading to decreased sensitivity. Although these symptoms often last for just a few minutes to a few hours, they should never be ignored regardless of whether they signal a stroke or another neurological issue. A TIA is a temporary condition of reduced blood flow to a part of the brain. 6. Issues with speaking difficulties, such as slurred speech or trouble articulating words or whole sentences, might strike someone who is likely to have a stroke. These issues fall under the category of aphasia, which is defined as the impairment in understanding, formulating, and expressing speech. 7. Neurological issues. People who are close to having a stroke, either ischemic or hemorrhagic, may experience a range of neurological symptoms such as memory problems. Nausea, vomiting, and loss of balance are symptoms that may appear days or even weeks before a brain incident. It's important to keep in mind, though, that similar symptoms can also be present in other illnesses, making the diagnosis process more difficult. Ailments like migraines and convulsions, low blood sugar, neuroendocrine tumors. These symptoms, for instance, can be brought on by illnesses in the central nervous system or anxiety episodes. It is essential to seek the advice of a licensed physician for a thorough assessment in order to precisely identify the source of these symptoms. What distinguishes ischemic stroke from hemorrhagic stroke? The causes and consequences of an ischemic stroke and a hemorrhagic stroke differ from one another throughout the brain. A blood clot that originates elsewhere in the body and moves to the brain can be the cause of an ischemic stroke, which is a blockage in the blood supply to a portion of the brain or by a plaque that develops in the brain's arteries. Plaque. There is an accumulation of fat and production of atherosclerotic plaque, which inhibits the flow of blood through the brain. As a result, atrial fibrillation is a type of cardiac arrhythmia associated with an ischemic stroke. Patients with high blood pressure, diabetes, increased cholesterol, and smoking may experience this. Brain injury may result when blood flow to a portion of the brain is interrupted, causing the cells there to become deficient in nutrients and oxygen. This kind of stroke is the most prevalent and accounts for 85% of hemorrhagic stroke cases. Blood can leak into the brain when a blood vessel bursts, causing blood to flow to places it shouldn't be. This can put pressure on nearby brain cells and cause damage, which can lead to a number of difficulties. In conclusion, an obstruction in blood flow occurs in an ischemic stroke, whereas a hemorrhagic stroke occurs when blood clots. There is a blood leak into the brain. Both stroke kinds are dangerous and need to be treated as a way to prevent more damage. A frequent reason for hemorrhagic strokes, a brain aneurysm, is the sort that includes bleeding, and you can detect the presence of one before it bursts. Cerebral aneurysms are abnormal enlargements in a brain artery that resemble bubbles in the arteries. The worry is that they could weaken and burst. Until it bursts, a brain aneurysm frequently shows no symptoms. The person experienced no symptoms at all, and then their cerebral artery bursts, resulting in a hemorrhagic stroke. Despite the fact that this can occur frequently, there are various symptoms and indicators that may also point to the existence of a brain aneurysm. It's crucial to understand that, although aneurysm rupture is a medical emergency, many people can live with their cerebral aneurysms without experiencing any problems. If you suspect a cerebral aneurysm, you should seek medical assistance as soon as possible. There are plenty of people who are unaware that they have a brain aneurysm. However, it's critical that you are aware of its existence. Tips for spotting brain aneurysms: because most cerebral aneurysms are asymptomatic, diagnosing one is possible. Aneurysms are investigated when there is a family history, so it's important for your first-degree relatives to undergo investigation. When a doctor suspects a cerebral aneurysm, they may order specific tests like a cerebral arteriography, Miss angiography, or CT angiography to check if the aneurysms are at risk of rupturing and if they need to be treated. Ways to avoid having a stroke: maintain your optimum weight. If you have diabetes, control your blood pressure. If you exercise consistently, get at least 150 minutes every week. Consume wholesome, fresh foods. Steer clear of processed meals. Steer clear of sweets, extra saturated fats, and alcohol. If you smoke, you should think about quitting. Get enough sleep to manage your cholesterol. Maintaining current checkups with your cardiologist will help. Avert a potential stroke in the road. As we conclude, it's crucial to remember that recognizing stroke symptoms early can be life-saving. By knowing the 7 signs of stroke and being vigilant about any changes in your body, you can detect the stroke quickly and seek medical help promptly. Recall fast. Time to summon emergency services: face drooping, arm weakness, speech trouble. Additionally, watch out for sudden confusion, trouble seeing, and severe headache. Do not delay if any of these symptoms are experienced by you or someone you know. Call emergency services immediately. Every minute counts in stroke treatment, and fast action can prevent long-term damage and even save a life. Stay informed about your health, spread awareness, and encourage others to learn about stroke symptoms and prevention. When we work together, we can save lives. Thank you for watching Health Angel Solutions. If you found this video helpful, please give it a thumbs up, share it with your friends and family, and subscribe to our channel for more valuable health tips and information. As we come to the end of this discussion, it's vital to understand the profound impact early detection of stroke symptoms can have on saving lives. Stroke is a medical emergency, and recognizing its warning signs ahead of time can be the difference between life and death. Remember, your health is your greatest asset, so let's take care of it together. Until we meet again, be well and remain healthy.